Hey guys, Jim Hoffman here for EMS Office Hours, and this is your Monday Minutes. So today I want to just quickly go over speech with a patient when you're assessing a patient's speech. And this could be primarily, a lot of times we'll do this with a patient that we're suspecting some sort of a cerebral vascular type thing going on, maybe a stroke, maybe a transient attack, and we want to go ahead and see, so we can document appropriately how their speech is. Okay, is it slurred? Is it delayed? Is it non-existent? Okay, so this is going to be just going over some of the key things you can look for, and also some terms that you should be able to go ahead and document more appropriately when you do your patient care report. So when we're looking for speech, what are we going to do when we're assessing? We are going to listen, right? So we want to listen to the quality of the patient's speech. Now, slurs is a big one, right? Because this is the main classic finding when we're looking at things like stroke, okay? And we need to see if and we listen as well to see if the speech is appropriate, okay? Focus on not just the quality of what the patient is saying, the words themselves, but also the appropriateness of the words. And what about recognition? Well, this is another thing we need to go ahead and think about as well, because sometimes the patient's speech might be clear, right, but their choice of words are not correct. So, go ahead and check the patient's ability to recognize something like a simple object. And again, keep in mind, guys, that speech issues often, because of strokes, but it also can be affected by things like injury and other illnesses as well. Okay, so looking at the entire picture here, I'm not going to go into all the different illnesses and injuries that can cause speech issues, but I want to just go ahead and mention that so that we keep in mind it's not just about checking these things for patients that have CVAs. Speech is an overall neurologic sort of exam we're giving to the patient, okay, for, of course, their cranial nerve functioning. Okay, so now there's something called agnosia, okay, and this is when the patient is unable to tell you the names of common objects. We're talking about recognition. So what happens here is that you've got damage inside the brain, and this is usually the connection between the visual interpretation of what they're seeing and the words that are associated with the objects. Now, the other thing is apraxia, which is something where the patient does not know how to use a common item or a common object. So this is when the patient, they don't know how to use it, and it's actually possible for the patient to be able to speak clearly and have, no knowledge of how to use something. So they're speaking okay, but you can hand them something, and they're not quite sure how to use it. So one thing you can do, and now a lot of us might not do this in the field because a lot of times you start seeing these types of things, that's sort of enough to guide you on your path to that there's something going on with the patient's speech or neurological issues. But if you're able to have time in doing this type of thing, you can show the patient a pen or maybe your scissors, maybe even keys, right? And ask the patient what the name of the object is. Okay, if they know what it is and they tell you exactly what it is, then give it to them and ask them how they would use it. Okay, and that's a good way to tell and be able to differentiate the agnosia or the apraxia. Now, the thing is with both of these things, guys, one is not more severe than the other, or finding one or the other. It doesn't really make a difference. It just kind of shows that there is a misfiring going on. Okay, and usually the misfiring is somewhere between, for agnosia, between the occipital lobe and temporal lobe, and for apraxia, talking temporal lobe and frontal lobe. Okay, so there's a misfiring going on. So one or the other, it doesn't really make a difference. Okay, and language it can be affected either by the injury or by the disease. Now, aphasia is kind of something that gets separated between receptive and expressive, and then we also have global. Now, receptive aphasia is when the patient can understand what we're saying, but they can't speak it clearly. Okay, and this is a damage that's happening to the temporal lobe. Now, something you can do to determine whether the patient has this sort of aphasia, ask questions which you and the patient are going to know the answer to. You know, things that we normally ask for alert and orientated questions. You know, who the president is, what year it is, things like that. Okay, if the patient can speak clearly but gives you incorrect answers, then he might be having this receptive aphasia going on. Now, expressive aphasia, and this is where the patient cannot speak for themselves. They're not able to speak clearly, but they are able to understand in their mind what it is that you're saying. So this is a damage to the frontal lobe and causes that motor function of speech. Okay, it's controlling that motor function of speech. So just ask the patient to raise his arm. If he can do it, then that means he can understand you, of course. But ask him his name. So if there's a lack of response or slurred speech when he's responding to you, then that is showing that he's having an expressive aphasia. Okay, so they can follow the command, right, but they can't express anything. They know what's going on in their head. They can understand what you're saying, but they cannot verbalize it. Now, global aphasia, a lot of times this is going to include both of the previous expressive and receptive elements of aphasia. Okay, but just one thing I just want to mention with global aphasia, guys, is that a lot of times the patient they can think clearly what's going on. Okay, you know, they're going to have the same needs and anxieties and things like that we normally go through, but they're not able to express it to you. Okay, this is going to be very frightening to a patient because, you know, they know it in their head what's going on, they can understand, but they can't verbalize it, they can't motion to what's going on. So this can be very frightening to a patient. So kind of keep this in the front of your mind when you get patients that are like this, okay? Because they can't respond again to your questions despite, you know, being able to really formulate the answers in their heads, right? So try to be sensitive to this, guys, and just try to reassure the patient. Don't do fast movement. Try to move a little slower than usual. Move more purposely for the patient, okay? And maintain the eye contact with them. Let them know that you sort of understand what's going on and you're going to try to do what you can to help them. Okay? And again, guys, all these little terms I'm mentioning here, great ways to document appropriately what's going on with the patient on your patient care report without having to spell out lines and lines of descriptions of what's going on with the patient by just saying agnosia or saying apraxia or aphasia and what type of aphasia it is. All great ways to document more appropriately what is going on with the patient. So guys, I hope you can use these Monday minutes. Be sure to send me some minutes of your own, then I'll be sure to create quick Monday minutes here on the blog. Send them over to me. It's admin@emsseo.com. And be sure to leave some comments in the notes below, guys. I'd love to hear what you have to think about what we talked about today. And check out the blog at emsofficehours.com and see some of the previous Monday minutes there. So until next week, guys, as always, Jim Hoffman, EMS Office Hours. Stay safe.